What types of toxins cause food poisoning in children? Imagine a child eating a meal that looks fine but makes them very sick. That's often caused by toxins from bacteria that contaminate food. These toxins can upset the stomach and cause symptoms like vomiting, diarrhea, and stomach pain. Sometimes, if not treated quickly, they can lead to dehydration or more serious health problems. The main culprits are different types of bacteria that produce harmful toxins. One of the most dangerous is Shiga toxin-producing Escherichia coli, often called STEC. These bacteria can be found in undercooked ground beef, unpasteurized milk, and contaminated vegetables. The toxins they produce can cause severe stomach illness and even damage the kidneys, a condition called hemolytic uremic syndrome. Another common cause is Staphylococcus aureus, which produces heat-stable toxins. These toxins can cause rapid vomiting and diarrhea, especially when foods like cooked meats, dairy products, or salads are left out at unsafe temperatures. If food is handled improperly or left out too long, these toxins can form and cause illness quickly. Clostridium botulinum is another bacteria that produces a very potent toxin. This toxin can cause botulism, a rare but serious illness that leads to muscle paralysis and breathing problems. Infants are especially at risk if they eat honey or foods contaminated with spores that grow and produce toxin inside their intestines. Older children can get foodborne botulism from improperly canned or preserved foods. Clostridium perfringens produces toxins that cause diarrhea and stomach cramps. These often happen when cooked meats or gravies are not stored or reheated properly. If food is left out too long or not heated enough, the bacteria can grow and produce toxins that make children sick. Listeria monocytogenes is another bacteria that produces toxins, allowing it to invade cells in the body. It can cause severe infections, especially in young children and pregnant women. Contaminated soft cheeses, unpasteurized milk, and ready-to-eat meats are common sources of listeria. Viral toxins also play a role. Norovirus is a leading cause of foodborne illness in children. Although it is not a bacterial toxin, it causes vomiting and diarrhea by infecting the gut. It spreads easily through contaminated food or water and can cause outbreaks in places like schools or daycare centers. In summary, food poisoning in children mainly comes from bacteria like Escherichia coli, Staphylococcus aureus, Clostridium botulinum, Clostridium perfringens, and Listeria monocytogenes. These bacteria produce toxins that contaminate improperly handled or cooked foods, such as undercooked meats, unpasteurized dairy, raw produce, and canned foods. Children are more vulnerable because their immune systems are still developing. Preventing food poisoning involves practicing safe food handling. Always cook meats thoroughly, avoid raw or undercooked eggs and seafood, use pasteurized dairy products, wash fruits and vegetables well, and store foods at the right temperatures. Do not give honey to children under 1 year old because of the risk of infant botulism. If a child shows signs of severe illness like persistent vomiting, diarrhea, dehydration, or muscle weakness, it is very important to seek medical help promptly. Remember, proper food safety and quick medical attention can make a big difference in keeping children healthy and safe.